I'm about to reveal something that could save you thousands of dollars and years of regret. Most dentists won't tell you this, but the choice between dentures and implants isn't what you think it is. And by the end of this video, you'll know exactly which option is right for you. Here's what nobody talks about. The cheapest option up front often costs you way more in the long run. I've seen people make this mistake over and over again. They choose based on price alone, and 5 years later, they're spending double what they would have spent initially. So let's cut through the confusion right now. We're going to break down everything you need to know about dentures versus implants. The real costs. The hidden problems. And most importantly, which one actually makes sense for your situation. Let's start with dentures because that's what most people think of first. Traditional dentures are removable teeth that sit on your gums. They've been around forever. Your grandparents probably had them. But here's what's changed in 2024. Modern dentures are actually pretty impressive compared to what they used to be. The materials are better. The fit is more precise. And they look way more natural than those old school fake teeth you're imagining. But they still have some serious drawbacks we need to talk about. The biggest problem with dentures? They move around. No matter how good the fit is, they're going to shift when you eat. They're going to click when you talk. And you're going to need adhesive to keep them in place. That's just the reality of having fake teeth that aren't attached to anything. Now let's talk about what this means for your daily life. Eating becomes a whole different experience. Certain foods are basically off limits. Corn on the cob? Forget about it. Apples? You'll need to cut them into tiny pieces. Steak? Good luck with that. You're looking at a completely different diet. And here's something most people don't realize until it's too late. Dentures need to be relined or replaced every 5 to 7 years. Why? Because your jawbone actually shrinks when you lose teeth. The dentures that fit perfectly today won't fit at all in a few years. So you're looking at ongoing costs and adjustments forever. Let's talk numbers for a second. A full set of dentures typically costs between $3,000 and $5,000. That sounds reasonable compared to implants. But remember what I just said about replacements. Over 20 years, you're looking at 3 or 4 sets of dentures. Plus all the adhesives, cleaners, and dental visits for adjustments. Now here's where it gets interesting. Partial dentures are an option if you still have some natural teeth left. They clip onto your existing teeth and fill in the gaps. They're cheaper than full dentures, usually running between $1,000 and $3,000. But they come with their own set of problems. Partial dentures put pressure on your remaining natural teeth. Over time, this can actually damage those teeth. So you might start with partials, but end up needing full dentures anyway. It's like a slow progression that many people don't see coming until it happens. Okay, let's switch gears and talk about dental implants. These are completely different from dentures. An implant is basically a titanium post that gets surgically placed into your jawbone. Then a crown gets attached to that post. It's as close to a natural tooth as you can get. The first thing you need to know about implants is that they're permanent. Once they're in, they're in. No removing them at night. No soaking them in solution. No adhesive. They function exactly like your natural teeth did. You brush them, floss them, and forget about them. Here's why that matters so much. Your quality of life stays the same. You can eat whatever you want. Bite into an apple. Chew a steak. Eat corn on the cob. Nothing is off limits. Your speech stays normal. And nobody can tell you have fake teeth unless you tell them. But let's address the elephant in the room. Implants are expensive upfront. A single implant can cost anywhere from $3,000 to $6,000. If you need a full mouth of implants, you're looking at $60,000 or more. That's a huge number that stops most people right there. However, here's the math that changes everything. Implants last 20 to 30 years or even longer with proper care. Some people have implants that last their entire lifetime. So when you spread that cost over decades, it starts to look different. You're not replacing them every few years like dentures. There's also something called implant-supported dentures. This is a hybrid option that gives you some benefits of both. Basically, a few implants get placed in your jaw, and then a denture snaps onto those implants. It's more stable than regular dentures but cheaper than a full set of individual implants. Implant-supported dentures typically cost between $15,000 and $30,000 for a full arch. That's the upper or lower set of teeth. They don't move around like regular dentures. You can eat most foods. And they last longer because the implants prevent bone loss in your jaw. Now let's talk about the health aspect that nobody mentions. When you lose teeth, your jawbone starts to deteriorate. It's called bone resorption. Regular dentures don't stop this process. In fact, they can speed it up. Your face actually changes shape over time, giving you that sunken-in look. Implants are the only option that prevents bone loss. Because the titanium post acts like a tooth root, it stimulates the bone and keeps it healthy. This means your face maintains its natural shape. You don't get that aged, collapsed appearance that happens with long-term denture use. Let's discuss the procedure itself because that's a big concern for many people. Getting dentures is relatively simple. Your dentist takes impressions of your mouth. A lab makes the dentures. You come back for fittings and adjustments. The whole process takes a few weeks and doesn't involve surgery. Implants require surgery. The dentist drills into your jawbone and places the titanium posts. Then you wait 3 to 6 months for the bone to fuse with the implant. After that, the crowns get attached. It's a longer process that requires multiple visits and healing time between procedures. Some people can't get implants at all. If you have severe bone loss, diabetes, or certain other health conditions, you might not be a candidate. You need enough healthy jawbone to support the implants. If you don't have it, you'd need bone grafting first, which adds more time and cost. Here's a question I hear all the time. Can you start with dentures and switch to implants later? Yes, absolutely. Many people do this. They get dentures initially because of the lower cost. Then they save up and get implants down the road. It's a valid strategy if you can't afford implants right now. But there's a catch. The longer you wear dentures, the more bone loss you experience. This can make implant placement more difficult later. You might need bone grafting that you wouldn't have needed if you had gotten implants right away. So waiting can actually increase the final cost. Let's talk about insurance and payment options. Most dental insurance covers part of the cost of dentures. They're considered a basic necessity. Implants, on the other hand, are usually classified as cosmetic. Insurance rarely covers them, though some plans are starting to offer partial coverage. Many dental offices offer payment plans for implants. You can finance them over several years, which makes the monthly cost more manageable. Some people use healthcare credit cards with promotional interest rates. Others save up and do the work in stages, getting a few implants at a time. Here's something crucial about maintenance. Dentures require daily cleaning with special solutions. You need to remove them at night. Buy adhesives regularly. Visit the dentist for adjustments. It's an ongoing routine that becomes part of your life. Some people adapt fine. Others find it frustrating. Implants need the same care as natural teeth. Brush twice a day. Floss daily. See your dentist for regular cleanings. That's it. No special products. No nightly removal routine. No adhesives. The maintenance is actually simpler than dentures, even though the initial investment is higher. Let's address the social and emotional factors. Many people feel self-conscious about dentures. They worry about them slipping during conversations. They avoid certain social situations involving food. They feel older than they are. These psychological impacts are real and shouldn't be dismissed. Implants eliminate most of these concerns. Because they're permanent and stable, you don't have the same worries. You can laugh freely. Eat in public without anxiety. Feel confident in social situations. For many people, this psychological benefit is worth the extra cost. Now here's my honest assessment. If you're on a tight budget and need a solution quickly, dentures make sense. They'll restore your ability to eat and speak. They'll improve your appearance. And they'll do it without breaking the bank. Just understand that you're signing up for ongoing maintenance and eventual replacements. If you can afford implants, either upfront or through financing, they're the better long-term investment. You'll have better function, better aesthetics, better bone health, and ultimately, better quality of life. The higher initial cost pays off over the years. For many seniors, the hybrid option of implant-supported dentures hits the sweet spot. You get the stability and bone preservation of implants. But the cost is more manageable than individual implants for every tooth. It's worth discussing this option with your dentist. Here's what you should do next. Schedule consultations with at least 2 different dentists. Get their professional assessment of your specific situation. Ask about all your options, including the hybrid approaches. Get written cost estimates that include everything, not just the initial procedure. Ask about their experience with both dentures and implants. How many of each procedure have they done? Can they show you before and after photos? Can you talk to previous patients? A good dentist will be happy to provide this information. Don't make this decision based solely on cost. Consider your overall health, your lifestyle, and your long-term goals. Think about where you want to be in 10 or 20 years. The cheapest option today might not be the best value over your lifetime. Remember, your oral health affects your overall health. Difficulty eating leads to poor nutrition. Social isolation from embarrassment affects mental health. Chronic pain from ill-fitting dentures impacts quality of life. This decision is about more than just teeth. One final thought. Technology keeps improving. New materials and techniques make both dentures and implants better every year. What wasn't possible 5 years ago might be an option now. What seems too expensive today might become more affordable tomorrow. Stay informed and keep your options open. The bottom line is this. There's no single right answer for everyone. Your best choice depends on your unique situation, your budget, your health, your priorities. But now you have the information you need to make an educated decision. Talk to your dentist. Consider your options carefully. And choose what's right for you. That's everything you need to know about dentures versus implants in 2024. Make sure you're subscribed so you don't miss future videos on dental health and senior care topics. And if you found this helpful, share it with someone who might be facing this same decision. Thanks for watching, and I'll see you in the next one.